Causes and treatment of watery sperm.
In this video, we'll be discussing the causes of watery sperm and how it can be treated. Watery sperm, also known as low semen viscosity, is a common concern for many men. Understanding the causes and potential treatments can help improve fertility and overall sexual health.
What is watery sperm?
Watery sperm is a term used to describe semen that has a more liquid or watery consistency, rather than the typical thick, viscous texture. This can sometimes lead to concerns about fertility and overall sexual health.
What causes watery sperm?
There are several factors that can contribute to watery sperm, including 1. Frequent ejaculation. Frequent ejaculation can result in a lower volume of sperm, leading to a more watery consistency. 2. Low sperm count. A lower sperm count can make the semen appear more watery, as it contains fewer sperm cells. 3. Diet and hydration. Poor diet and inadequate hydration can affect the consistency of sperm, making it appear more watery. 4. Age. As men age, their sperm production and consistency can change, leading to a more watery texture. 5. Medical conditions. Certain medical conditions, such as infections or hormonal imbalances, can cause watery sperm.
How can watery sperm be treated?
While watery sperm might not always be a cause for concern, there are a few things you can do to help improve the consistency of your semen. 1. Reduce the frequency of ejaculation. By reducing the frequency of ejaculation, you can give your body more time to produce and replenish sperm, which can result in a thicker consistency. 2. Maintain a balanced diet and stay hydrated. Eating a healthy diet rich in vitamins and minerals, and drinking enough water, can help improve the consistency of your sperm. 3. Exercise regularly. Regular exercise can help improve blood flow and overall health, which may contribute to healthier sperm production. 4. Limit exposure to heat. Prolonged exposure to heat, such as hot baths or tight clothing, can have a negative impact on sperm production and quality. 5. Seek medical help. If you suspect that an underlying medical condition is causing watery sperm, consult a healthcare professional for a proper diagnosis and treatment plan. In conclusion, watery sperm can be caused by a variety of factors, including frequent ejaculation, low sperm count, diet, age, and medical conditions. By addressing these factors and implementing healthy lifestyle changes, you may be able to improve the consistency of your sperm and overall sexual health. If you're concerned about your sperm quality or have further questions, it's always best to consult a healthcare professional.